Now, as surgical alternatives to traditional filtering and tube shunt procedures increase, do you find that there would be more opportunity for cataract surgeons to manage glaucoma? And if so, do you think that they will make that transition?
I'm an anterior segment surgeon, cataract surgeon. I'm not a glaucoma specialist. And I find that that's really, from the cataract surgeon's perspective, the traditional surgeries we have, tube shunts for the most part, general ophthalmologists is sort of out of their field.
Right.
And even trabeculectomy surgery, which many surgeons feel comfortable with and do, we're kind of hesitant. Patients who have cataract surgery want a quick recovery. They don't want their eye to be red. They don't want to, and unfortunately, a lot of the current surgery, surgical incisional surgery, really involves a little bit of a prolonged recovery period, and sometimes patients can have postoperative inflammation and long-term issues with blood risks. So I think that the newer technologies that will avoid extraocular surgery, I think the key is that cataract surgeons can get involved in glaucoma therapy if they feel that they're in their comfort zone. And a lot of the new technologies really do that. If it's a trabecular stent, for example, the intraocular procedure such as the Glaucoma eye stent really is within the comfort zone of most cataract surgeons. It's done at the time of cataract surgery and under magnification with a special gonioscopic lens and high magnification. Trabecular meshwork is visualized, and that stent is placed into the trabecular meshwork and English lens canal, and really has a relatively short learning curve, and it's, again, within the comfort zone of most cataract surgeons.
And Carlos, don't you think that since there's so many cataract surgeries being done, that with the opportunity to do a glaucoma procedure in conjunction with it, you'll get more and more comfortable because you'll actually bring up your volume in what you're doing for surgical intervention for glaucoma as an anterior segment surgeon. So I think that that'll be a natural evolution that will occur, because what will be happening is that people, as they're doing the cataract surgery, will say, well, this patient's on a couple of medications. I think that if we put the stent in, they'll be able to get a better pressure. And I think it'll really have a nice niche market for many of the patients undergoing cataract surgery.
Patients definitely want it. I mean, when I talk to patients about, well, we can do the cataract surgery alone, or as part of this trial that we can do a cataract surgery plus do a procedure to help you with your glaucoma, patients overall are very receptive.
Right.
I joke around that there's a lot of promotional work within ophthalmologists to do to get to get patients excited about presbyopic IOL. So get rid of your glasses, get rid of your glasses. We don't really use that term, but that's what patients are hearing. And oftentimes I have patients saying, doctor, fine, I can get rid of my glasses, but when will I be able to get rid of these stupid drops?
Right.
So I think that's in the mindset of the patients too.
Right, and so they're trying to kill two birds with one stone, obviously. That would be ideal.
And if they're looking to get a presbyopic lens put in, the last thing you want to do usually is a trabeculectomy in conjunction with that, but just because you're going to have astigmatism and other issues with it, whereas something like the Glaucoma eye stent, you could even look at this, putting a toric lens in.
In the trial I did use several patients had presbyopic IOLs with their glaucoma, so they had a 3-for-1.
Yeah.
There you go. Well, tell me, what do you think the benefits are of performing a combined cataract procedure with patients with concomitant cataract and glaucoma? You talked a little bit about this, but can you expand?
I think that the numbers that Carlos went through, talking about the data that Dr. Samuelson presented, is very important. And the cataract surgery itself is a great procedure for people that do have glaucoma. So I think doing a cataract surgery in itself is a benefit to glaucoma patients if it's indicated and necessary for that to be done. But on top of that, when you're inside of the eye with the cataract surgery, to do the extra few minutes that it takes for a combined newer surgical procedure, I think is well worth the investment of the time and the energy of the doctor to look at this as an option, much more so than doing maybe a combined trabeculectomy and cataract surgery, just because the newer ones will be an easier adjunct to go together with that.
Yeah, I think it's a no-brainer from the patient's point of view and from the doctor's point of view. One trip to the operating room, we may be able to fix both problems. There may be some issues, and there's remember that with the Glaucoma eye stent, we are limited in how much pressure reduction we can get. We really can't reduce pressure below the episcleral venous pressure. So a patient with bad glaucoma or a patient where you really need a super low pressure, this may not be the right procedure. The nice thing about the eye stent is that this really does not interfere with possible future surgery. So a patient who may later on need a trabeculectomy or later on need a tube shunt really doesn't interfere with that. So I think it's a high chance, there's, thank goodness, a low level of adverse events in the study, and seems to have very good results for mild to moderate glaucoma, which is what the patients we were looking at in the study.
Great.
You know, but I do think our numbers can be pushed a little bit lower. I went up to visit Ike Ahmed recently, and he's putting a couple of the stents in with people, and that in conjunction with a once-a-day drop, he's getting pressures that are, you know, almost single digits.
Wow.
You know, so I think that we can look at that by combining things, and what we're going to find once this is available to us to use full-time, we'll look at expanding the horizons of where we've been and how we can use this as either adjunctive therapy for people that have had other procedures done, or as primary therapy, maybe where we're putting in a couple of the stents. And then we'll find out how the medicines work in conjunction with that to really develop a better algorithm. And this nice, fast, easy procedure will be something that we can look at that. And when I say easy, I mean, obviously there's a lot of technical skill that goes into that, as you mentioned, but I think with the doctor's willingness to spend time learning this procedure and putting it in their armamentarium, it's well worthwhile.
With all of the new developments from companies like iScience and Glaukos and Aquisys, do you think that we can separate glaucoma specialists into clinicians and surgeons?
You know, I think that you have to be a clinician first and foremost to be taking care of your glaucoma patients, and really all of us that take care of glaucoma patients analyze that. I think the real trouble has been that the surgical implementation for glaucoma specialists has been something they've been very reluctant about because of all the problems that have been associated with it. I think we're evolving. I think we're going to a new generation with new algorithms of treatment for our glaucoma than we've seen ever in the past. And I think as that gets better for both the patients and the doctor, it'll all evolve into one big package. And I don't think we'll have necessarily a separation of clinicians versus surgeons. I think it'll all tie together. And I actually think surgical intervention may be considered a much more of a primary treatment than a secondary, as we've seen somewhat with selective laser trabeculoplasty and other similar lasers. I think we'll see that evolving.
You feel the same way?
Yes,
Yeah.
I agree.
Yeah. Well, gentlemen, it certainly seems like the world of glaucoma needed some shaking up with all these new surgical interventions and combined therapies. So it sounds like they're going to really provide a true benefit to the patients, providing surgeons such a great opportunity with new treatment modalities. Thank you so much for sharing your perspectives with me, and I'm Christine Cannellan for iTube TV.